In this episode, Michael Kinney discovers why amusement park rides make you sick. Chris Robinson looks at why gold is so valuable. And Persis Golwala tells us why men have nipples.
So, Mike, you want to go on the zipper? So, how about the monster? Come on, Mike.
Well, you know, there's a long line for that. Why don't you go hold a place in line, and I'll meet up with you later, okay?
Yeah, sure.
You know, amusement park rides provide most people with amusement. But I'm not sure if the amusement comes from the thrill of the ride or watching other passengers suffer. You know what I'm talking about, the shortness of breath, the dizziness and nausea, which ultimately leads to tossing your floss. Well, the official name for that lousy feeling is motion sickness, and it's not confined to just amusement park rides. Air sickness and seasickness and car sickness are all forms of motion sickness.
To understand what motion sickness is and what causes it, you need to know a bit about how we keep our balance. Balance is a complex process requiring a constant flow of information to and from the brain. Three things provide this information. The eyes provide visual cues. Receptors in our skin, muscles, and joints report on the position and movement of various body parts. But some of the most critical information about balance comes from our inner ears. The inner ear consists of 3 semicircular canals and 2 tiny chambers, all filled with fluid. Inside the fluid sits tiny hairs that are attached to nerves. As the head moves, so do the fluids, shifting the hairs, which immediately send signals to the brain. It's like having a set of tiny levels inside your head. These levels detect different types of motion: vertical, horizontal, and rotational. The brain uses this motion information to keep us upright and balanced. For example, when we turn our head, signals from the inner ear help our eyes adjust so we don't become disoriented. The inner ear also tells us when we're falling over, so we can stick out an arm or leg to regain our balance.
So what does balance have to do with motion sickness? Well, to keep us balanced, the brain coordinates signals from the eyes, the body sensors, and the inner ears. And it usually does a pretty good job. But sometimes these signals get mixed up. This sensory mismatch is what causes motion sickness.
For example, let's say someone's managed to talk you into riding the monster. The combination of up and down and all around has the fluid inside your inner ear sloshing around all over the place. Your eyes are trying to focus on something, but can't. And your body sensors are telling you that you're not moving at all. Well, your brain can't process the conflicting information. The confusion leads to dizziness, then nausea, and ultimately, well, you... Now, you don't need the tilts and spins of an amusement park ride to give you motion sickness. A leisurely car ride is enough to make some people sick, especially if they sit in the back seat. Because when you sit in the back seat, you really have nothing to look at. All you can really do is look out the side window where the scenery just flashes past. So when you look out there, your eyes tell you, hey, we're really going fast. Now, if you hit a bump in the road, or turn your head to talk to your friend, that gets the fluid in the inner ears going, and they tell you, hey, you're only moving slightly.
Meanwhile, your body sensors are saying, you're not moving at all. There's a problem. The brain becomes confused with these mixed signals, which leads to shortness of breath, nausea, and, guys?
Yeah?
I think you better pull over. Now, no one's quite sure why we vomit when we get motion sickness. The running theory is that it's instinct.
When the brain receives conflicting signals from the rest of the body, it assumes there's some kind of poison in the system and that it better get rid of it. So it signals the stomach to eject its contents. So, can you do anything about motion sickness? Well, unfortunately, once the cycle begins, it's hard to stop. You just have to ride it out. Prevention is easier than treatment. There are a number of medications on the market. They work by blocking or deadening the nerves that trigger nausea.
Now, there are some drug-free techniques, like focusing on a distant object, like maybe the horizon or a tree. They're fixed. That way, your brain has something to concentrate on, so when those motion mismatch signals get to your brain, they get a busy signal. All right, I'm ready. Focus, focus. Okay, no problem. I'm ready here. Oh, we're going up, though. Yeah. 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 Great ride, great ride.